The 12-lead electrocardiogram. Exhibiting professional behavior. Identify the patient correctly. Introduce yourself to the patient. Explain the procedure to the patient. And obtain informed consent from the patient. Preparing the patient. Prepare the trolley that you will be using during the 12-lead electrocardiogram. Wash or spray your hands. Reassure the patient that the procedure is not painful, and ask the patient to relax and breathe normally. Do not talk to the patient while you are busy tracing the ECG. Any vibration of the chest will cause artifacts. Ensure the patient's privacy by exposing only the necessary parts of the patient's arms, legs, and chest. Also provide warmth and reduce the patient's anxiety, which can cause shivering and alter the ECG reading. Position the patient in a supine position at a 45-degree angle. The patient should not touch the bed rails or footboard. Prepare the patient's skin. Use an alcohol swab to remove any sweat or lotions where necessary. If necessary, remove all excess hair with a clipper to ensure that there is a good contact surface where you have to place the electrodes. Remove any digital devices from the patient to prevent interference with the electrical signals. Obtaining the ECG. Switch the ECG machine on and connect the lead wires to the electrodes before placing the electrodes on the patient. This will minimize any discomfort for the patient. For the purpose of demonstrating where the electrodes should be placed, we shall connect the wires at a later stage. Check the standardization settings on the ECG machine to ensure an accurate trace within standard limits for proper interpretation. Paper speed, 25 millimeters per second. Sensitivity, 10 millimeters per millivolt. Ensure the filters are on to minimize artifacts. Place the chest electrodes as follows. Identify the angle of Louis, the sternal notch. Then identify the second intercostal space. From there, count to the fourth intercostal space. Then place the chest or vector leads in the following intercostal spaces. V1, fourth ICS right parasternal. V2, fourth ICS left parasternal. V4, fifth ICS in the midclavicular line. V3, midway between V2 and V4. V5, on the same horizontal level as V4, in the anterior axillary line. V6, on the same horizontal level as V4 and V5, in the mid-axillary line. Electrocardiogram machines are all unique. You should make sure that the correct colored lead wires are placed in the appropriate areas when you are using a specific one. Place the limb electrodes in fleshy areas and avoid bony prominences. Place them equidistant from the heart and symmetrical on each limb. The arm electrodes should be placed on the volar aspects of the wrist. The electrodes for the feet should be placed medially and a few centimeters above the ankle. Ask the patient not to speak, to relax and lie still. The patient should breathe normally, as any chest movement can distort the ECG tracing. Press the appropriate button on the machine to initiate a recording. Record the patient's details on the printed strip ejected from the 12-lead ECG machine. Indicate the patient's name and hospital number or date of birth of the patient. Note their vital signs, for example, the patient's blood pressure, their cardiac symptoms, for example, their chest pain, as rated on a scale of 0 to 10, or their heart palpitations, their hypertension, and/or cardiac medicines. You have successfully completed your assessment of the patient, and you can now inform them of the next steps to follow.